I will be presenting on ethnography, prepared by Martha Jean Jacks and Barbara Marandino. What is ethnography? It is relevant wherever people are relevant. Could be as small as a biker's gang or as big as a historical culture such as Native American Indians. Ethnography aims to understand why a culture exists, how the group came together, and what their culture or association norms are. Ethnography is a form of qualitative research because it focuses on observation and surveys instead of implementation, scoring, and numbers for an outcome. The main forms of data include documents, artifacts, and photographs, and ethnography is often a long form of study lasting months to years. Types of information. Ethnography focuses on three main types of data collection: cultural behaviors, which are tendencies, actions, or activities; cultural artifacts, which are images, photographs, or symbols; and cultural speech, such as personalized slang that is present in diaries, used in personal interviews, observational logs, and field notes. Diaries are the main focus for data collection for historical studies. Participant observation uses key informants or insiders, and these insiders are able to give pertinent information when the researcher is not present or of events prior to the start of the study. Good rapport is needed if the researcher wishes to use cultural observation of the activities or events. Direct observation is used from the researcher's perspective, and final ideas are reached with the assistance of interviews, field notes, and logs. The idea of the culture is cultivated using videos and photos to give a realistic image of the notes taken by the researcher or researchers. Steps of ethnography. Number 1, the steps of ethnography are to identify the question. This is often driven by the information from the key informant. 2, find a location or culture the question is pertinent to. 3, gather data either told or witnessed. 4, analyze the data and collect an understood meaning of what the culture represents. And 5, present or report the findings to raise awareness of a specific group or culture of people. Sampling and framework. When looking for the key informants, a big net approach is often used to collect a broad idea of the culture. Upon further understanding, the researcher will use a small number of key informants. The potential informants are chosen based on their role within the culture. Final selection is based off of the informant's knowledge level of the culture and the willingness to report and collaborate with the researcher. The key informants give the details to the researcher on what exactly they should be looking to study. Additions to ethnography. Additions to ethnography include ethno-nursing research, which is a transcultural nursing approach to promote culturally congruent care. Critical ethnography is used to raise the consciousness of the population to affect social change, raise political dimensions, and undermine oppressive systems. Autoethnography is often used to mix self-observances and thoughts with a cultural's data from key informants to paint a more descriptive study image, as seen below. Ethnographers. Ethnographers are often outsiders unless working within an ethnography setting. Ethnographers aim to see the culture from an emic or insider's point of view. Ethnographers want to learn from culture, not study a specific question or finding. They often just want to understand the inner workings. They drive to understand the deepest cultural aspects that only the ones inside of the culture can understand. but also want to understand the idea of the culture that may be so far buried, even the key informant is not conscious of it. Example study. The study example chosen is titled Experience Barriers to Adherence to Pre-Exposure Prophylaxis for HIV Prevention Among MSM, or Men Who Have Sex with Men, a systemic review of meta-ethnography of qualitative study. The study objectives. Men who have sex with men in the United States are at high risk for HIV. While pre-exposure prophylaxis is a highly effective method for preventing HIV infection when taken once daily, it is specifically aimed at high-risk individuals such as MSM. This treatment requires optimal adherence to maintaining its effectiveness, and though it is effective in preventing HIV, adherence was found to be a challenge. This study reviews qualitative research to identify barriers to pre-exposure prophylaxis, adherence among MSM who have used the medication. The method that was used was a meta-ethnography approach. The study systemically reviewed the synthesized qualitative studies focusing on cisgender MSM in the United States who use once daily oral pre-exposure prophylaxis. The study concluded that the need for tailored interventions that address the specific experienced barriers across different socio-ecological level is required to improve pre-exposure prophylaxis adherence among MSM. Ethnography methods in the study. The research study used ethnographic methods to explore the cultural context of MSM's experience with pre-exposure prophylaxis. It aimed to understand barriers to adherence by capturing both insider, also known as emic, response perspectives from MSM and outsider, also known as etic, interpretations from the researchers. Data collection involved in-depth interviews, participant observation, and analysis of cultural artifacts, aligning with ethnographic techniques. The research combined results from extensive fieldwork offering comprehensive accounts of the challenges in adhering to pre-exposure prophylaxis. It revealed tacit knowledge, such as internalized stigma and cultural perceptions, aligning with ethnographic principles as described by Pilot and Beck 2022. Challenges and limitations to ethnography. According to Pilot and Beck 2022, while ethnographic research offers deep insights, it faces challenges such as being time-consuming, resource-intensive, and subjective, necessitating extensive fieldwork, substantial financial and human resources, and complex data analysis. Researchers may bring biases and subjectivity, which can affect the interpretation and objectivity of the study. Generalizability. Findings are often specific to cultural context and may not be easily generalizable or applicable in other settings. Ethical considerations must be carefully managed, and the dynamic nature of cultures make capturing an accurate representation very difficult. The presence of the researcher may influence participants' behavior and responses. And lastly, building trust and gaining access to community can be challenging, especially in sensitive areas like MSM and HIV prevention. Challenges and limitations in the study. Structural and policy barriers, which are costs affecting pre-exposure prophylaxis adherence, fragmented health services, frequent care requirements, and language barriers. Addressing these barriers require extensive fieldwork and significant resources, making the process time-consuming and resource-intensive. Building trust with healthcare providers and MSM communities is also time-consuming, and maintaining participant confidentiality when discussing sensitive issues like cost and affordability is crucial. Barriers at the social interpersonal level includes stigma from providers and peers, relationship dynamics, and provider competency. To grasp and interpret these experiences, researchers must be aware of their biases and the impact of their presence, as these issues are frequently left unsaid, posing a difficulty in revealing insights without prolonged fieldwork. Barriers at the individual level include internalized stigma, risk assessment, anxiety, sexual satisfaction, empowerment, and medication side effects. These personal experiences are subjective, leading to challenges in interpretation and researcher bias. Additionally, analyzing these factors requires detailed and nuanced data analysis, making it challenging to establish the credibility and accuracy of findings due to their subjective nature. Implications for APRN in nursing. Ryan 2017 explains that ethnography has been extensively used in nursing research to explore patients' perspectives, healthcare systems, policies, and nursing profession. This method allows for in-depth understanding of patients' experiences and behaviors. Understanding diverse cultures. This offers in-depth insights into cultural backgrounds and how patients behave within them, enhancing the ability for APRNs to deliver tailored and effective care. Enhanced patient-centered approach. This allows APRNs to tailor interventions according to the values, beliefs, and social context of patients, improving adherence to treatment regimens and promoting health and wellness. Identification of barriers. This uncovers barriers to accessing healthcare and adhering to treatment plans that might not be obvious through other methods, thereby facilitating solutions for challenges like language barriers, social stigmas, and disparities in healthcare. Holistic healthcare. This supports a holistic approach to patient care, acknowledging the interrelationship between physical, emotional, and social elements, which APRNs can include into their practice, ensuring that all aspects of patients' well-being are being addressed. In the context of the study, understanding the obstacles MSM face when following pre-exposure prophylaxis treatment, including social and personal challenges, enables APRNs to develop tailored interventions that address these unique needs, improving adherence and overall health outcomes. Ethnography supports a holistic approach to patient care, recognizing the interconnectedness of physical, emotional, and social factors, which APRNs can integrate into their practice and use these insights to educate patients, healthcare providers, and the community, thereby reducing stigma and promoting a supportive environment for MSM. And this concludes our presentation. Thank you.